Care Alliance Health Center is the leading provider of healthcare and comprehensive dental services to individuals and families who are experiencing homelessness or living in public housing and are uninsured or underinsured. So we provide free or affordable health care to individuals that otherwise wouldn't have any resources or any access to health care.
The facility with which we provide health care is a beautiful facility, but it reflects the great men and women who serve here. The commitment to quality care, the commitment to a clean environment, and the commitment to the hope that we provide with our health care is what makes Care Alliance such a significant community asset.
I can tell you to go to Care Alliance and they'll treat you right.
We serve as a primary care center where we provide a medical home for patients. We provide the services that you would typically get if you would go to a family practice physician, with some limited specialty care.
I think you need to take a visit to the St. Clair office and just see what a gem it is and see what they're able to provide here. It's really remarkable. It's as good of care as anyone could get anywhere when we're talking about primary care.
Care Alliance Health Center is located in the heart of downtown Cleveland, within walking distance of homeless shelters and the correction center, and also accessible via bus lines. In addition to this primary site, Care Alliance also has two other clinics strategically located on the east and west sides of Cleveland. Both are housed in public housing buildings, so they are easily accessible to residents.
Well, I've been homeless 3 years now. After my wife passed away, I just gave up on everything. Yeah, that's pretty much it.
So in addition to having the clinics, we have an outreach team which is comprised of an outreach nurse and an outreach worker who are actually out there under the bridges, in the heater vents, any place that homeless persons may congregate.
Her and Judy once did save my life. I had a pneumonia and didn't know it. They recommended a doctor over on the east side, through Care Alliance.
You can't, it's very hard there to leave your camp or to go to the centers and stuff there.
Yeah.
Because you got these guys coming in here, people coming in here and taking things from you there.
And that's what we do with outreach, is be present to the person's situation and meet them where they are so that we can engage them in a trusting relationship and bring them into clinic and have them seen medically by a doctor.
Today, the concept of homelessness has changed. Home foreclosures, job loss and unemployment, and severe medical needs can lead to any one of us becoming homeless, including the elderly, women, and children.
The homeless people that we serve are wonderful people. They're bright and they're wonderful, beautiful people, and it is a gift to be able to serve them.
What kind of propane you use?
A little green cylinder. You got it hooked up?
I got you too.
Oh, bless your heart.
Beautiful.
We just ran out the other day, didn't we?
Yeah.
Oh,
Truly, do you really think that was his first time doing it? I mean,
he probably has done it on occasion.
That's what I'm saying.
But in this particular instance, in this book, it didn't say that.
We started a book club at one of the men's shelters in Cleveland, and it's turned out to be a really wonderful experience for the men and for us. And sometimes when people relax in a situation, they're very open in talking about what their conditions are and agreeing to help. It's just another way to develop a relationship.
Sometimes when you go into a facility to get medical care, especially when you don't have any money or anything, people kind of look, you feel like they're looking down upon you. But I didn't get that feeling here. I really didn't. Everybody seemed like a family, and everybody was cool.
My experience previous to that was, kind of, I don't know, just being treated like a number. It wasn't that way at all at Care Alliance. It was a very warm atmosphere. They were kind, they were respectful, they were compassionate, considerate.
All right, any questions?
No.
I'm so proud of you.
Thank you, sweetie.
I'm so
Thank you very
proud
much.
of you.
Thank you.
Let me get the inhaler prescription and then we'll see you in 3 weeks.
All right.
Okay, take care.
Bye-bye.
But let's take a person who has dental needs and needs an employment. If we're able to provide the patient what the dentures that he or she needs, it builds self-esteem. The person is able to seek employment. Person is able to seek housing.
In public health, we talk a lot about prevention, how important it is that we tackle problems as early as possible so they don't become bigger problems. And that's what Care Alliance does.
By integrating our care more and more with other community providers, we think we'll be able to provide a higher level of care and take some of the burden off of some of the other medical service providers in the community.
Community health centers really truly save the community tax dollars by being able to take care of our uninsured at a lesser cost than if they were going through an emergency room visit.
As funding from the federal government decreases, additional support from other sources is needed.
I don't think I'd be alive today, put it like this, without getting my medicine.
It's the best healthcare organization in the city.
If Care Alliance weren't here, we believe that our homeless population would have a very, very difficult time accessing care. We can't really say enough good things about Care Alliance. We think that they do a tremendous job. They are a vital organization in our community. They fill a tremendous role in shoring up that safety net of care, and we would encourage anybody who has the capacity to do so to support their good work.
Care Alliance absolutely turned my life around for the better. They just gave me a new lease on life. They gave me my health back.